Wednesday, May 10th, 2017 Budget Committee to order. It is 2 o'clock. We don't need to introduce our score on the table.
No.
So, first item of business is approved minutes, but we do not have minutes yet prepared to approve, so we will take that on tomorrow. I want to remind everybody that tomorrow is at 1:30.
I move we don't approve minutes.
Ever again, or just today?
Let me think about that.
So tomorrow is at 1:30, same place. I just want to remind everybody, well, you folks will be after lunch somewhere, I'm sure.
Oh, no, we'll be back, I think.
You're going to be back.
So that's good. So I'm not late, thanks.
Okay. Is there any committee business? Anything for the good of the order? Okay. Well, as we can see, as a budget committee, we are outnumbered by the presenters. So I suggest we keep our comments soft and sweet. So with that, Alicia Hayes, Director of Health and Human Services, and a cast of thousands.
That's right.
Go ahead.
You know, thank you for inviting us here today to talk to you about Health and Human Services. It used to be managers I don't want to go. Now it's like, when is the budget committee? I can't wait. Come on. It's probably you, Dennis. They're waiting for the usual comments. So, but anyway, I do want to introduce some managers today. I'm going to go ahead and introduce all of them. Some are presenting today, and some are not. But while they're in the room,
Karen Gaffney, Assistant Director.
Lisa Nichols, Assistant Director.
Louise Colbert, Admin. Mike Barnhart, Clinical Financial Services.
Ron Chow, Community Health Center.
Amber Musicat, Developmental Disability Services. Lisa Stewart, Human Services Division.
And Brian Johnson, Public Health.
Ms. Buckle, Julie, Behavioral Health.
Natalie Freiner, Youth Services. And Kay, Community Health.
Welcome.
all right. So we have a presentation for you today that will not take the whole time we have time with you. It actually takes. We've timed it about half. Not only have we presented and practiced this, we have now choreographed it for you. Dennis got to witness how are we going to get everybody up and down quickly, and the baseball analogy of being on deck. So watch that. We'll have somebody on deck and somebody in the circle. So as you can see by the slide, we do have 9 divisions, and we're going to present 7 of those divisions today. Tomorrow, Behavioral Health and Youth Services will be part of the public safety presentation. Start off with a little bit of numbers for our department. We're going to look at the total number of employees, that's 622, and the total FTE, which is 576.8. If you look at your budget books, it's a little different. You'll see a different number. It's not, it just changes. It changes almost daily as we're adding staff. If you look at the numbers, you can see that our largest division is our Community Health Center, and our smallest division is our Clinical Financial Services division, all of which are very important. Size does not factor in on this one. So we're going to go ahead and get started. Are you ready? Let's see if we can do this.
So in the interest of time, we're going to lift up just 3 examples of highlights from this last year, and we'll give you 3 additional ones tomorrow when we meet with you. I'm going to talk about our FUSE project that we launched last fall. Our Frequent User System Engagement effort is really a great example of our community partnershiping and work that we do with public safety, law enforcement, the jail, Trillium from the medical side, the hospitals, to identify the 100 top users of those systems and put them in housing. So it's a housing first project based on models in other communities that have really generated significant savings for the system. This year we were able to start with 10 people, and our hope is to be able to grow that project. We have a grant proposal pending in particular. The second highlight I'd lift up is our expanded data and analytics efforts. In a department our size, we have lots of data, and what we need is information in order to be able to make decisions. So we've expanded our data team and also invested in business intelligence software this last year to help us be able to use all that data to guide our decision making. And then finally, this last year, we launched our new strategic plan. We have 4 pillars that are listed up on the slide and 3 goals that cut across our department. The first is to reduce tobacco use. It's still the leading preventable cause of death in our community and in our country, so that's our first goal. The second is to increase trauma-informed care across all of our services. We talked a little bit about that last night and the importance of trauma-informed care. And then finally, the third is our Project 250, which is a new initiative over the course of the 3 years of this strategic plan. Our work will be to identify 250 of our most complex patients across our whole department, and then really focus on integration of services and connection with the community and case management to improve outcomes for those 250 people. So we'll share data with that as we move forward. On our highlights, we included some pictures of a few of the aspects of our department. I'd lift up a couple particular things. 30,000 patients at the Community Health Center. Last night, the county administrator talked about 5,000 new patient appointments in the last year. Our Human Services Commission serving over 9,000 homeless people through the programs that we serve. Again, that's a topic that we talked about last night, and I expect we'll continue to talk about in our community. Our Veteran Services in the lower corner, every year we talk to you about the really amazing work that happens in our Veteran Service Office. This last year, $5.2 million in retroactive benefits was brought into the community for veterans, and that's in addition to the $613,000 of recurring monthly payments that we were able to secure for veterans in our community. Our picture of our Tobacco 21 sign, that was significant work from the Board of Health this last year to change the law across the county, and pointing out that our DD program is serving more than 2,000 children and adults, and Andrea will talk to you more about that. And then finally, rounding the circle with our Community Health Improvement Plan. When we finish, we'll talk about the county strategic plan and how we fit into that, and the CHIP is certainly a big piece of that.
Okay, so now to talk about the services and outcomes that Karen just talked about, we've got to talk about the money behind them in order to do that. So this slide shows the total revenue for each H&HS fund, and so the general fund is included in each one of those funds. So with Fund 286, which includes the 4 listed divisions up there, general fund accounts for approximately 4%, or just over $2.2 million. The majority of that goes to public health, with smaller amounts going to behavioral health and admin, and DD does not receive any general fund. Fund 285, which is the Human Services Division, their general fund equates to 6%, and their other funding comes from federal and state funding, fees, and local sources. And then finally, TBH and the CHC, Trillium Behavioral Health and the Community Health Centers, funds 287 and 88 do not receive any general fund. And like Alicia said, we're going to talk about behavioral health and youth services tomorrow, so I'm skipping over them. Did you get it? Okay. All right, and so now this slide shows the revenue by type for H&HS. So as you can see, general fund accounts for a very small amount, about 7% of Health and Human Services overall budget. So the other category, I wanted to explain that a little bit, it's at 30%. So that includes fund balance carryover, CCO incentive dollars for the CHC, refunds and reimbursements, private donations, parking, and special projects. Now, the largest section on this graph is the revenue is federal state dollars. So that accounts for just over $48 million at 34%. So as you are well aware, there's lots of potential changes around those dollars. There's a state budget shortfall. There's changes, particularly with healthcare at the federal level. So we are certainly very closely monitoring those events and doing contingency planning in case there are shifts in those dollars.
The administration budget provides the support to 8 other divisions in the department. Our resource budget is $5.6 million. Of that, the 2.8 is allocated out. It's the admin cost that's allocated out to the divisions. We have $83,000 general fund that pays for a portion of a resource development position. And the remaining $2.6 million is a combination of its fund balance carryover, and it's a combination of our department contingency of $1.6 million and a little under $1 million that's set aside for the mental health settlement payback once the grant settles. On the expense side, we have 8.9 million budgeted. The reason that's different from the resource side is because we have a 3.2 million transfer of general fund in there for everything except for the youth services division. In administration, the challenges for the upcoming year are the state budget has changed from flexible spending to specific service elements with requirements, and they've also added new service elements along with increased reporting requirements for our subcontractors. The biggest part of that challenge is they have not completed the reporting templates yet, so we're working on developing subcontracts without the metrics for what we need to make sure our subcontractors meet. And then of course we have the continued recruitment for providers. It's an ongoing effort.
Clinical Financial Services has a unique role in HCHS in that we provide services directly to the FQHC, the Federally Qualified Health Center. And that's community health centers, that is behavioral health and public health. So as a result, all of our revenues are generated by charges for services to those three divisions. On the next slide, the expenses, you can see the majority of our expenses are personnel and benefits, with about a third there, I guess, as materials and services. Our services are specifically, sorry, I knew that was going to happen. Our services are four. We do patient billing for all the medical and behavioral health clinics. We do provider credentialing. We do the support, the computer support for the electronic health record, as well as financial analysis for the FQHC. There we go. Next one. So the challenges and changes ahead for us. I have three that I picked up here. The first one is what Karen mentioned earlier, is the data analytics and reporting. So with the growth in the FQHC and improvements in technology, we are now able to aggregate data across multiple platforms. That has allowed us to visualize and report on clinical and operational measures, including the social determinants of health, to improve the lives of our patients. Number two is claims processing opportunities. We are currently working to improve the integrity of our claims processing through what's called an implementation of real-time edits. The goal is to reduce claim denials, which will speed up cash flows, and then reduce our ratio of days in accounts receivable. And the third one is alternative payment methodologies. Currently, we have basically fee-for-service models in Oregon for the most part, but that limits us in the ability of the medical staff to provide and meet the real needs of the patients, because there's an overemphasis on face-to-face encounters. So the CHC and us are working with the state to move us to a capitated payment model, and that would give the doctors an opportunity to tailor their care to the unique needs and circumstances of the patients. So in conclusion, Clinical Financial Services provides the support for the FQHC to help them fulfill their mission of the health care for the Lake County citizens.
The community health centers provides a range of primary care and preventive dental services to the underserved members of our community. I'm proud to say that last year we provided just over 78,000 individual services to 30,000 members of Lane County. There is no general fund contribution to the community health center. The majority of our revenue is generated from patient billings, primarily for Medicaid services. So of course we're very closely monitoring potential changes to the Affordable Care Act. We've been building contingency funds to mitigate any adverse impact of regulatory changes, should this occur. We're also focusing on improving the efficiencies of our patient care teams. And part of this focus is on improving our performance on clinical quality measures. Performance on the clinical quality measures is particularly important, not only as a reflection of the quality of the care we provide, but is an increasingly important factor in the amount of payment that we receive for the services. As I noted earlier, our largest challenge in the year is the uncertainty in the regulatory environment, both at the state and the federal level. Another challenge is our ability not only to recruit, but to retain providers over time. I'm very proud of the fact that over the last 2.5 years, we've recruited 15 primary care practitioners into our community. Unfortunately, over this time, we also lost 4 providers to other agencies in the community. An ample and consistent provider base is critically important to fulfill our mission to the community, but also to our ongoing sustainability.
Hi, Developmental Disability Services. So Developmental Disability Services does not receive general fund. We have state and federal funding. Next slide. Basically, like Karen said, we provide case management services to over 2,000 children and adults with intellectual and developmental disabilities who live in Lane County. We also do abuse investigations for adults in our services, and we also certify adult and children DD foster care homes. So this legislative session, it's possible that DD will see some cuts in our funding, but we've done some contingency planning for that to keep staffing levels the same for this next fiscal year. Some challenges and changes. So as I said, there's some possible state budget reductions for the DD system. We have increased caseload sizes. So right now we have over 200 people in intake, and caseloads are averaging about 70 individuals per caseload. And then we will continue. We're also working with our H&HS division partners and community partners to look for resources for acute care issues, as well as to find more resources for individuals who have co-occurring behavioral health challenges. And the most exciting thing that happened this week in our office is we have a new electronic health record. I'm very excited. It's going to increase efficiencies in our office, as well as allow us to provide more customer service in the community. So thank you.
Andrea, did you say 2,000 kids?
Children and adults.
Children.
The Human Services Division, we have one-time state funding from last year that was not renewed, and the ongoing state funding from the state and federal, we're not sure if it will continue at that level this year. HSD has 4 distinct program areas. Poverty and homelessness projects serve 57,000 people a year, with food, clothing, emergency, winter warming, shelter alternatives, permanent housing, and rent assistance. Veteran Services helps 1,300 veterans and their survivors file claims and receive the benefits that Karen already outlined with you. The Workforce Services helps 3,000 people navigate their way back into the workforce with job search assistance and career guidance. And Energy Services provides energy assistance to 12,000 households a year, conservation education to 1,000, and weatherizes 120 homes. The expenses, you'll see that family mediation moved from HSD to youth services, so that appears as a reduction in both revenue and expenses. We have targeted ongoing planning with partner agencies, which has resulted in a prioritized list of services and populations that we use for planning and resource allocation. And 24 nonprofit agencies participate in the Community Homeless Management Information System, which tracks direct client services. So Lane County is experiencing high housing costs, no availability of affordable housing, and low vacancy rates. Low-income people and people with housing barriers are finding literally no housing options. So inadequate housing and homelessness continues to increase. A Housing First project of 50 units has been launched, but to be successful long-term, this innovative approach needs to be a trend and not a one-off. And H&HS is launching Project 250, which will address the needs of clients using or will benefit from using multiple H&HS programs. It's an integrated case care management approach. It will tailor and leverage services to the participants and will inform and enhance our program delivery in our divisions.
Lisa, quick question. The 57,000, does that include HACSA recipients?
It includes everybody who uses our management information system.
Thank you.
Yeah. Which is
So the Public Health Division works to promote and protect the health of all who live in Lane County or who may potentially visit. And we strive to build a thriving community where all people can reach their full potential. To achieve this, we provide a range of services from preventing disease outbreaks to ensuring safe food and drinking water, providing supports for parents and families, supporting and promoting mental wellness, among others, which you can see on the slide there. And the division is largely funded through federal and state grants, fees, and county general fund dollars. Many of the federal and state grants are categorical, so they have specific limitations on the types of services we can provide. Nearly half of the funds come from state and federal grants, and we're particularly susceptible to changing priorities that are not within our specific local control. Public health work is largely accomplished through the talents of our staff and the relationships that we build and work to create. And as such, most of our expenses are due to personnel expenses and the materials and services and support that support their work. And then a smaller portion includes the physical transactions and a small reserve fund that makes our budget. There's several opportunities for challenges on the horizon. Of particular note, there's an ongoing discussion at the state legislature about investing in public health to modernize and strengthen the work that we do. This effort could result in a substantial influx of dollars into public health. However, if fully implemented as proposed, but again, budget shortfalls of the state legislature make it difficult to anticipate when that might happen, and it's likely to be relatively limited in this particular year. Lastly, the Public Health Division is leading in advancing the Lane County Community Health Improvement Plan, which is a strategic plan for health, and over time, this collaborative effort has good potential to leverage new funding or align resources for more sustainable investment in public health. However, on the very near horizon, this is challenged by the ongoing uncertainty in public health and again for many of our strategic partners.
Hello. Trillium Behavioral Health has good budget news. We don't use any general fund, and we have a secure budget going into the future. Our revenue is primarily from the Oregon Health Plan, and in partnership with Trillium, and other revenues are some state fund contracts and system transformation funds. Our costs have increased as we hire more staff and expand our responsibilities. For instance, we've added a program to serve older adults with serious behavioral health conditions, and we've been recognized in the state as doing the best job of implementing that. We also have identified 4 to 6 system improvement investments, and we'll be RFPing those hopefully in the near future. In 2016, Trillium transitioned to the Centene system, and this has caused some challenges for Trillium Behavioral Health, and for providers. And one of the things has been internal changes in care management, and we have redesigned our staffing and our workflow to be more aligned with the way that they do things. We're also focusing more on complex care management to serve those members with the most complex needs. In the current healthcare environment, making predictions about the future are challenging. As you've already heard, the state budget deficit is going to we won't get any capitation increases in 2018, so our budget will be stable for the next year. And of course, the outcomes in the federal healthcare changes are unpredicted. Despite that, I think that we'll be financially stable for at least the next 2 years. Thank you.
So, hopefully this looks familiar to most of you, and I know you can't probably read the tiny print, so let me lift up a couple things. These are the 3 county goals across the top. In that first category, safe and healthy county, we'll talk about examples in the safe tomorrow. The healthy, I'd lift up the Community Health Improvement Plan and that work that the board has adopted. We are absolutely championing in our department. That includes work with economic development and public works. It also includes the supportive housing work that Lisa talked about, as well as increasing access to primary care and behavioral health. And also in that category are some of the partnerships that we'll talk about on the next slide. Oftentimes people don't think about health and human services in terms of the work on vibrant communities. It's a little bit more of a natural fit on the safe and healthy side. So in this category, I might lift up examples such as environmental health and the work that we do on the drinking water program and our collaborations with DEQ on hazards, as well as a significant amount of work in terms of equity and access. Not only is that a pillar in our strategic plan, but the way we operationalize that includes, I believe we're up to 6 community advisory committees that we work with, as well as our internal equity committees and the work that Lucy Zamorelli in Bruce's staff does as the health equity officer for Trillium in the community. And then finally, we also support infrastructure as we look at our buildings. We're located in 9 different sites in the Eugene-Springfield area, and certainly work on maintenance there. And then this larger question of administrative infrastructure and the work that Lanice and Mike in their divisions do in particular to make sure that we're being fiscally accountable, and we're working with subcontractors to ensure accountability around that as well. And then finally, you asked about partnerships, and really we could spend the rest of the afternoon talking about partnerships because we can't do our work without the community. But there are 4 here in particular that we'd lift up. You've heard from a couple speakers about Trillium, our coordinated care organization. We're a critical public partner in that public-private partnership. Year before last, they were worth $28 million to our annual budget, so it's a significant revenue driver as well as a key place where we influence the community. We work with United Way in a number of ways, including serving on the governance bodies for the Early Learning Alliance and 100% Health. Our work with the Poverty and Homelessness Board is significant in terms of addressing those issues in the community. And then I think Lenise talked too about our nonprofit delivery system. We have significant, I would imagine there's hardly a nonprofit in the community that doesn't contract with us.
Okay.
Questions, Gail, go ahead.
Hi, Alicia. As you
I
know,
can call a friend, right?
you shouldn't need to. As you know, mental health services are near and dear to me, and I know, especially with the audit, some of the complications that you guys are struggling with. What's happened in terms of the recruitment front?
So let me we're going to talk about behavioral health services tomorrow, so we can go a little more in depth. But I do want to talk about recruitment, not only of behavioral health, but of our CHCs. And Ron, I don't know if you're up for answering a question about, and we have Lori, who really is our guru.
We brought Lori McKay, who is our Chief Operating Officer, in part because I anticipated that we might have some questions about recruitment, and Lori does yeoman's work and has for many years in provider recruitment.
So is your question, how difficult is it? What are we doing?
I think what the changes have been made to address the from what I understand, it's really a staff lack of recruitment ability to get the qualified individuals here to provide the treatment.
So I'm just picking the one person that can answer all of it together.
But how are we?
I'm going to ask you, Sarah.
So I'll start maybe, and then others can fill in, and I think it would be great to address this again tomorrow, specifically in the behavioral health context. We have, particularly in behavioral health, added a number of positions in the last year or so as we've transitioned to this team-based care. So we've had a lot of practice about how to do the best recruiting. What we've discovered thus far is that it really helps to streamline our process as much as possible. So we've done a lot of that. We get rid of barriers and encourage applications in. So we've opened up positions at what we call a mental health specialist 1 level, which doesn't require a license, get people in the door who have their master's degree, and then help them get the experience to be able to move to a 2 level once they're licensed. We've limited the number of questions we ask on applications because we're trying to get people to want to fill out our application and not someone else's. So streamlining in those ways, making sure we're responsive and turning applications around quickly when they arrive so that we don't lose candidates. A very competitive environment, and I think that's true as you look at nurses as well and physicians, both psychiatrists and primary care docs. It's just a very competitive environment. So salary is certainly a piece of the recruitment. That's what captures people's attention. And then once we get them in the door, what do we do to retain people? So all of that has been a focus for us.
And then the county as a whole has hired a recruitment coordinator that we've been working with. And we, I look at Lori and I say, she's great at docs and PAs and NPs, and then Carla has done the work, and I think the mental health specialist 1 has made a huge difference in really looking at how we support those folks to move up to mental health specialist 2. So we've put in a number of new ideas and new systems, and again partnered with our HR office to do that recruitment.
Just a follow-up on that regarding recruitment. Talk a little bit about about the cost of housing in Lane County and how difficult that is regarding recruiting people. Based upon the fact that our salaries competitive, sometimes not quite competitive. What about that as it compares to housing? What do you hear about that?
I haven't.
Lori, are you hearing anything specifically about housing?
Depends on where they're coming from. Certainly. A lot of the stocks that are coming to the community, and it really does depend on where they're coming from. But if they're selling a home and moving here, they're often looking to buy another home in short order, but often they're looking to rent. And what I struggle to do right now is help connect them with a property manager who's willing to give them much information. And also a lot of people are coming with young children and pets, and finding a place that they could rent for, a period of 4 to 6 months that will take their pets seems to be a challenge for a lot of our folks.
And you talk about doctors and professionals. I mean, a lot of the people you're recruiting are people with master's degrees, for instance, who don't have, or maybe entering their first job.
Well, if they have a house to sell, for instance, we have a physician who's joining us in July, there's a house to sell in Florida. It has some hurricane damage, and that's not going to sell quickly. He doesn't anticipate. So he wants to rent for a number of months until that's all dealt with there.
And that's a physician.
Right, so Commissioner, I'm not sure we have the exact data. I know that housing is an issue, we know that. And so when we're bringing in mental health specialists or somebody that wants to move to our community that isn't a physician at that salary, I can only guess that it's an issue. And I haven't talked or, maybe you guys have stories of people you've hired who you've supported and helped them find places. So I don't know if that answers your question. We probably it's an interesting concept, and I don't think we've drilled down into that as a county as a whole yet about housing. Might be something we want to look at.
Well, if you're hiring somebody at $48,000 a year, and they're going to be paying $20,000 in rent.
And I think in some of those cases, we may not hear that because people self-select out and don't apply. Lori's able to connect because she's reaching out to other states, but I think for a lot of those classifications, we may not even get to meet them because they don't apply.
I think that's
Thank you.
First, thank you guys. You talk so fast, it was really hard to...
It was a little bit like a fire hose, wasn't it? Yeah.
But both Karen and Lenise mentioned Housing First. And I was just curious, you said there were 10 people already placed. Where are they placed?
So that's our Fuse project, where we were able to use one-time money for those 10 people. I don't know exactly the locations. What we've been able to do for those is to use vouchers that Hacksaw has been able to offer us as part of that. Lisa may actually...
It's scattered site rentals through property management companies in the community, and also at shelter care. There's a bridge. They're using shelter care units as a bridge until they can get into a rental in the community.
Lenise, you mentioned a project of 50, I mean, that's not up and running yet, is it?
No, that's launched, and that's through the Poverty and Homeless Board.
I can tell you more about that at some point.
I know you can.
Other questions? Welcome, Phil.
I have one more.
Go ahead.
Nobody talked about detailed budgets, but
Okay, we're ready.
So I noticed materials and services went down substantially, and it looked like it was because of $6 million, mostly $6 million less to other agencies.
Which page are you on?
Well, I started on page 179. It shows materials and services down $9 million. And then on let's see.
It's on page 186, is that?
Then on page 186, agency payments are down $6 million, so that's most of it. So those are payments that you make to other agencies to implement your
I'm
program.
going to stall a little bit while Lenise looks, because she's actually knows our numbers better than anyone. This roll-up goes across all the divisions, so that's why it's a little challenging to figure out exactly what that is. And it's budget to budget, so I know in some areas what we've done this year is really true up our budget more too. So it could be that it's not actually going to be a net reduction to the community, but when we budgeted for current year, we were anticipating higher expenditures in some of those agency payments and then trued that up for next year. Lenise?
I think that's, I think Karen. Get the exact detail of which ones we dropped down, but I can bring you the exact detail of which ones we dropped down, but we did true up, and we, in Trillium Behavioral Health specifically, we dropped down agency payments substantially. But I can get you the detail of exactly which ones went down.
I don't need that, thanks.
Okay.
Okay. Good.
Mr. Chair, for addendum questions or comments from committee members, I just wanted to take a minute to...
I do have one more question. That was actually a follow-up on this one, but my question is on Fuse. One-time only funding that we got for Fuse. That helped us replace 10 people. What's going to happen now with Fuse?
That is a great question. As I think almost everyone here mentioned, we're waiting to see what happens with the state budget. So certainly there's some hope that there will be funds that come through that way. There's been a request to the jurisdictions. That's a project that's been incubated in our Human Services Division, although it certainly touches other aspects of the department. So there's been a request for additional funds through that route, and we are waiting to hear, hopefully by September, on a significant SAMHSA grant that we submitted that would allow us not only to continue but to grow that program into next year.
And I'm taking Commissioner Swanson lessons in knowing the answer before I ask the question.
Yeah, I hope I got the answer right then. How'd you do?
You did, but really what I wanted to point out is the frequent user system engagement is the way of the future in terms of finding out how we can best use our diminishing small resources regarding behavioral health and regarding keeping people out of the judiciary system. So frequent user system engagement, we had a one-time grant. The money's been spent. We need to continue it. We need to expand it. We need to make it last into the future. So nothing. I don't have any suggestions as to where to dig money up right now, but it's something we're going to hear about quite a bit as we go down the road.
I do have one more. Ron, I think you mentioned Centene system. Is that, or somebody did?
Oh, Bruce.
Bruce Price.
Oh, Bruce. What is that?
Trillium is a health plan, and it was started by the Life Hub, which was an organization, and it was sold or purchased by Trillium about 3 years ago, or by Centene rather. Centene is a large national health plan.
Yeah, I didn't know the name, but I know.
That's it.
Thank you.
I have a question.
It's not the usual question, is it? When's Rob coming back?
It's actually on the subject we're talking about. In my mind, a lot of the healthcare services that you all provide are medical services, actual healthcare to people and we're kind of their last resort. I guess I'm scared to death of what's happening at the state budget level and what I see and hear about cuts to medical services and the federal government. No one knows where that's going to land or if it's even going to change this year or if the Senate's going to kick it out. So my question is, what preparation are we doing or conversations are we having if the state craps out and the federal government does the same? Are we going to be able to shift and continue to provide services for those serious, right now kinds of needs, recognizing that some things are going to be reduced, but are we going to be able to deal with the urgent issues that our community faces?
So I'm going to ask Ron, he gave a presentation to the board a while ago, so not that long, but...
No, we are committed to continue to provide services to individuals underserved in our community. That's a key component of our mission. A little less than 10% of the individuals we serve today 7.5% are uninsured. By comparison, before the expansion of the Affordable Care Act, that was in the high 30%. So it has certainly made a significant impact, beneficially, not just financially, but also in terms of the care that's available in the community to individuals who have coverage. But as we indicated, we're doing a number of things to prepare for the uncertainty. The most important is building contingency funds. We've been able to operate for a number of years now in a surplus, and so we are judiciously retaining those so that we're prepared for a transition. We don't know what might happen in Washington or Salem, but that contingency will help mitigate that. Community health centers have long-standing, 50 years of broad bipartisan support, regardless of whether it's a Republican or a Democratic administration, broad bipartisan support of community health centers. So we do get some grant funding, about a little less than 10% of our budget are grants to help pay for the uninsured, and we expect that those would continue, as well as other sources of funds. So I don't suggest for a minute that it will be easy sailing, but it is not waters that we have not charted before the expansion of the Affordable Care Act. I think the biggest impact, quite frankly, we certainly will have a financial hit, and we project that we will continue to be a little better than break even, but close. The biggest impact, quite frankly, on care, if there's a significant change, and many of those folks who are on Medicaid today go to an uninsured status, won't necessarily be the care that we provide within our doors. It will be the continuity of care, or the lack of continuity of care in our community, because the specialists and other providers who we're able to refer to now, who gets at least some compensation from Medicaid, they just can't afford to provide the level of care. And that's, I think, where the real impact will hit in our community, is we just won't have the resources for those individuals, for specialty care, for a range of agency care. And what will happen is that they'll not be able to get that care, and we'll see what we saw before, is people who will get care then in the emergency rooms.
Right.
Including dental and behavioral health care.
Well, speaking solely for myself, one of the beauties of Lynn County and the budget preparation is the outstanding work that's been done. But speaking for myself, if there is a need to revisit what I described as the potential loss of ACA, state, federal money, and all the things, if we need to revisit or reemphasize or bring that into this budget committee discussion, I would be all ears. But I understand that supplemental budgets can happen as these things unfold. So this issue, this very issue that I mentioned, I think is probably the most significant issue we're going to see this budget cycle, is the potential for damage to a lot of very needy individuals.
And I just want to assure you, as Ron said, we've planned, so it won't be a surprise. It won't be a change in service the next day. We have a glide path. We'll be working, whatever happens, we'll work with county administration, we'll work with our team, and make sure that it's at least we will have enough in reserves to weather a while and be able to look at options with regard to the CHCs.
Okay.
Ron's presentation of the commission was much longer and more in depth.
So if you're interested, Dennis, in more information, we can absolutely get it to you.
No, I don't
And I
understand.
appreciate it's a big piece of the budget, and I think making sure you all understand how we're dealing with that is really important.
I don't want to spend any more staff time than necessary on these sorts of reactions to comments. But like I said, my experience here, this is probably the biggest issue facing the county. Finally, the county's got everything going right the way we should, and we've worked very hard for many years to get better and better. And I'm sensing that behavioral health, health and human services has come a long, long way. And it's unfortunate that some of our funding sources may get us. So I just I want to appreciate all the work you guys have done, and I don't want to move backwards any further than we have to if our funding sources dry up. Okay. All right.
Mr. Chair.
Go ahead.
I was going to.
I was just going to ask for a copy as well for Ron's presentation.
What we can do is send to the budget staff maybe to forward a link to where it is online if you want to view it and the slides.
It's on the agenda. Thank you. Go to the agenda and pull it.
Dropbox. Well, Dropbox tomorrow.
No,
I suspect.
November 9th board meeting. I can send it to you right now.
Okay, well, that's fine. I know we have issues with who puts stuff on Dropbox, but my hope is everything we saw today will be on Dropbox tomorrow or the day after. So, are you using Dropbox?
Yes.
Good. So, yesterday's presentation showed up today. It's a wonderful thing. I told Judy earlier. I think whoever started this Dropbox idea, whoever that might have been, deserves a $1,000 raise.
I
did it. That was me. That's what we're changing the period by.
Commissioner, if you could tell him he has to stay 10 more years, that would be helpful.
And I'll give fair warning. The stuff we saw yesterday and got on Dropbox today, the beauty of it is it's on my computer. So next year, Christine, when you make your presentation, for example, we're going to see what you said last year. And we'll be able to... I think it's...
When they need plagiarism, no repeats.
It really uses technology, and it keeps the information here so we can refer back to it and ask intelligent questions, which I haven't been able to do in the last 12 years. So, okay.
Mr. Chair. I had a brief comment, if it's all right, I'd like to make. So to sort of dovetail off of what you were talking about in terms of how impressive this is and how far this department has come, I wanted to recognize Alicia Hayes. This will be her last budget. Am I correct?
No, I'm coming to testify at the next budget.
This will be her last budget as the director.
I have it on my calendar already.
Alicia's retiring, and it's, I don't want to get it wrong, is it how many years?
31.
31 years with Lane County in various capacities, and as the director over the past several years. She took over this department at a really difficult and challenging time when the department was consolidating with a number of other departments, significant reductions in budget and services, consolidation of functions, an influx of resources, an expansion of other services, and she's just done a phenomenal job, and it was really impressive to me to see this whole team come up and very efficiently and effectively and quickly move through all of their areas. I had recently one of the division managers said in a meeting we were in that it was, Bruce said this, I was going to try to leave it anonymous, but said in the time that you've been here, I think you said that this was the best division management team that he's experienced. I have seen the development of this team and the cohesion of this team come together in the short time that I've been here. And I attribute a lot of that to Alicia's leadership, and so I just wanted to recognize her. She also served as the interim county administrator and the budget official for one budget.
Christine's like, thank goodness that's over.
During a critical time of transition as well, so I want to recognize her incredible service to Lane County.
As you can tell by the number of questions I actually answered, that's where the brains are.
And not to diminish that, but also Bruce, this is your last budget.
Yes. Well, not if he gets his $1,000 over 10 years. It is true.
Alicia, if you're going to testify next year, I'm going to need a gavel.
I'm absolutely coming to testify. I'm going to find some little...
Okay, any other comments? Anybody? Okay. We have a break scheduled, and then Public Works for about an hour. Okay. Great.
I was forced.
Item
I forced
4
Michael to throw your cake.
is Public Works. The show is all yours.
Thank you very much. My name is Tim Elsey, and I'm the Public Works Director for Lane County. I've been here since August 24th of last year, so I'm pretty new. So if I happen to say anything insightful and smart today, it's because I've been prepped very well by the team over here. But if I miss anything, which I'm certainly certain I will, then I will have some help. I do want to say that I've never presented in front of a budget committee before in a government setting. I did have the opportunity once. I was hired by Schweitzer Mountain Ski Resort. They hired me on to run their mountain utility operations, and they wanted to build a business plan for the utility work and just build a business up on the mountain, separated from mountain operations. And so they hired me to come in to do that, and I had 6 weeks before it was the big quarterly investors meeting so that I could present my budget. I worked with a financial analyst that I've told Tanya she reminds me a lot of her because she's incredibly smart and never let me get away with anything. She was from Australia, by the way. The morning of the meeting, as might happen in North Idaho, our dogs got jumped by skunks. And so that smell stayed with me up to the top of Schweitzer Mountain. And I get up there and I get to the office and I look at Abby and I said, "Abby, do I smell like skunk?" And her response was, "Oh God, yes." And so then she kept walking around the office going, "What are you going to do? What are you going to do?" So anyway, this has started off better than that one.
So which part reminds you of Tanya? Because I love Tanya.
Absolutely. And, you know, I do want to start by introducing Tanya Heaton, and she is one of the best financial analysts. She's our budget and finance manager, and she's one of the best that I've worked with throughout my career. I've been in public service for over 20 years, but I've also been able to work with some Fortune 500 companies, and I've never worked with any that are any better than what Tanya is. And her help in putting this budget together and ensuring that we follow the budget direction that we've been given has been invaluable. She has worked with her band of merry budget analysts, including Suzanne Mueller and Christine Thornhill, who have worked with each of the division managers, and they've just done a tremendous job in putting this together for us.
Thank you.
So, the Public Works Department consists of 8 different divisions, and one of the things that I want to say right now is that we actually have a dream team of division managers in the Public Works Department, and I've said this before, but it's absolutely the truth. In running the Engineering and Construction Services Department, we have Peggy Kepler. She's been here for less than a year in that official capacity, but she has very high expectations, and her team is getting used to her high expectations. She, the Engineering and Construction Services, plans, designs, and constructs transportation system improvements, and they also hire the county surveyor, or house the county surveyor. Fleet and General Services is definitely run by Michael Johns. We're incredibly lucky to have him. Michael's worked all over the world, actually running fleet services. And fleet services, of course, is anything that rolls and a lot of things that don't roll. But also, not long ago, he took on facilities, which will include facilities maintenance and custodial services. We're not going to talk about that in detail today. Those are internal service rates that we're going to talk about, I think, May 23rd, if I remember correctly.
For the record, I hired Mike at Jerry's about 24 years ago.
The Land Management Division is run incredibly well by Lydia McKinney. Lydia is our planning director and division manager. That's a new change in that division, and it's a very difficult bar to reach, but she does it incredibly well. She's one of the brightest land use minds that I've ever known. She's built a very strong team around her to support her, but she does a tremendous job in that division. Lane Event Center is run by Corey Buller. Corey has the best business acumen of anyone that I've ever seen in that capacity. I love going over and spending some time over at Lane Event Center. I had an opportunity. They got new concessionaires this year, and so they were bringing all of their customers in to meet the concessionaires. And I realized that they don't just serve customers, they build relationships. Because what would happen is, as long-term customers would walk in the door, the hugs would start. And they truly understand that to be successful in what they do, they have to build those relationships so that they have people that stay with them through good times and bad. And they do a tremendous job over there. He is also served by a very, very strong team. I call he and Rachel Bivens the dynamic duo. They are awesome. Parks and Animal Services is run by Mike Russell. And I'll never forget the first time I met Mike. Well, first of all, he maintains 71 parks and with very few employees and with a budget of about $4 million. And I shook his hand and I said, you are a man, well, actually I said, you are a man that does a lot with a little, and he does. That's a very small budget to maintain 71 parks. He does that incredibly well. We'll be talking about the Parks Master Plan that we're putting together right now, but he also has campgrounds. We have about 5 different campgrounds, and then marinas and animal services that he takes care of. Road and Bridge Maintenance is run by Orrin Schumacher. Orrin is just, he's like our point guard. He's good at everything. He's definitely a very, very strong leader. And he hasn't been in road maintenance all that long when you get right down to it, but he's got the best instincts of any road maintenance division manager I've ever been around, and he's one of the best leaders that I've ever been around. Truly cares about his employees, and it shows, and they would do anything for him. They really stepped up for him during the ice storm and the winter events we had this year, so we're really, really proud to have him. And finally, Waste Management is run by Dan Hurley. Dan is just a rock star. Dan stepped in to be the Public Works Director in Marcia's absence. He's also stepped in as AIC for the Assistant Public Works Director. And while doing that, he's a true visionary. He's looking what this community, how this community is going to handle solid waste many, many years into the future. This past year, he renegotiated a contract with EPUD for our waste to energy to allow us in the future to get more putrescibles or organic matter out of the waste stream and still comply with that contract. So Dan has just done a tremendous job, and we are incredibly well served with all of these division managers. They are all innovators, they're very strong leaders. They have been incredibly generous counselors to me, and they're great public servants. So, to give you some of the highlights that we are dealing with. So first of all, the Parks Master Plan. In Parks, we have started a community outreach to do a reset on a Parks Master Plan effort that started many years ago, but through feedback that we got from that process, Steve very generously helped us out so that we got an extra $100,000. We have hired MIG Consultants, who is the consultant that's leading this effort. They are leaders in the field for developing Parks Master Plan. We are going out and meeting with residents now. We've had 5 public meetings so far. We will have 2 more. The public meetings have been tremendous. We are also in land management. We have service requests that are increasing. Our appeals are increasing. We have 3 new positions that we're requesting, and I will be discussing that with you. And then we have some key staff that are retiring, and we have challenges with replacing some of our key staff. In waste management, Dan has done a tremendous job closing the structural gap through fees and operational improvements. One of the things that he's done this year that you'll see start July 1st is that commercial haulers, rather than going out to the Glenwood facility, will be going out to Short Mountain Landfill. That is a tremendous savings to us because we will no longer have to have the equipment and manpower necessary to move it for that short distance. I do want to say, too, that he is served by an amazing team there. He had a couple of operators that went to the Solid Waste Association of North America, the SWANA conference, and they won some awards in equipment, running equipment. And also he had a team out at Short Mountain Landfill that just won a Langenuity Award for the compactive efforts that they're achieving at the landfill, which will increase the longevity of the landfill as we move forward. Fleet and facilities, again, we're not going to talk about that a whole lot right now, but we are going through an auditing process so that one of the things that Steve has emphasized since he's been here, and certainly with me since I've been here, is to ensure that we give as good a service to our internal customers as we do to our external customers, and make sure that we identify any efficiencies that make sense in our operations. And so we will be doing that over the coming year. In the Lane Event Center, we're currently in the process of getting a facilities assessment that is being done by a consultant. We should have the results of that soon if we haven't gotten it yet. And then after that, we'll be developing a business plan that we'll bring to the Board of County Commissioners for them to approve. And then in the road fund, we have ECS, Road and Bridge Maintenance and Administration. We've just been through a road and bridge performance audit there, and you guys got a presentation from Shanda Miller last night. Shanda changed my life with this performance audit, and I don't say that lightly, actually. She has given us a metric for how we can determine whether or not we are spending the right amount of money maintaining our roadways that I've never seen before, and I've been in road and bridge maintenance for over 20 years. It's a simple metric, which basically, and I'll just use simple numbers, but if you have 1,000 miles of road, which we have more than that, but if you have 1,000 miles of road and you do 100 miles of chip seal, and a chip seal will extend the life of your pavement 7 years, then you have maintained 700-year miles, and you're missing that 300-year miles. So using the type of investments that we're putting into the road system with the type of preservation techniques, how long we expect those preservation techniques to last with the cost will allow us to determine whether or not we're spending the right amount of money to maintain our road network where it is now. We'll be getting a similar metric on bridges as well, but with that little trick that she's taught us, we will use that certainly as we move forward. So some of the highlights of the outcomes in our department. We have certainly building permits. We deal with 4,400 building permits per year. This past year, we overlaid 14 miles of road. We have a campground occupancy of 56%, which is very, very good. Dog license purchase are almost 6,000. Now, one of the issues that we're dealing with is we're having to recruit a lot of positions. We've had a lot of turnover in the department, a lot of it due to VSIP, a lot of it due to some of the PERS issues that have been discussed up at the legislature this year. We chip sealed 56 miles of road, which, using some of the tools that we have learned through the audit, is making sure that we know that we are not we're not keeping up with the need on the roadways. We can talk about that a little bit later. And then, of course, we put on the fair. So FTE by divisions. Again, we have 8 divisions in the department. In administration, we have 18 full-time equivalents. That includes county public works director, the assistant public works director. It would be payroll, AR, AP. Tanya would sit in there, and then our contracts administration is also in administration. Engineering and construction services, we have 41 FTEs right now. We're asking for that to be up 1, and that will allow us to hire 2 engineering interns, which can come in and help us with the inspection and design of our construction projects. This will not only give us some flexibility as we put the construction projects together, but it will allow us an opportunity at bringing some college students in to see what we offer and to start building succession planning. Fleet and general services, we have 46.49 FTEs. Land management, we're asking for 3 additional FTEs in land management. This will include adding a planner, adding a land management technician, and a compliance officer. One of the issues that we've had, especially with the onset of marijuana in the county, is that we've had a lot more complaints for compliance, and we've had to respond to a lot more compliance calls. So this is in response to the commissioners asking us to be more responsive. Lane Event Center has 14.5 FTEs. Parks and Animal Services has 18.25. That's up 0.49, and that's for the animal welfare officer. This is another service that we have provided, but we only had 1 animal welfare officer in the county, and we've been asked to put on additional help so that we can have a backup in that position. The waste management is 83.87 FTEs. That's down 0.51 FTEs. That's due to the operational efficiencies that Dan has put into place. And sorry, I missed road and bridge maintenance. That's 80.5 FTEs. That's up 1. And that's to finalize our Waymaster as a full-time equivalent in the road department. We have handled that through unclassified seasonal help in the past, and so we are going to, with approval from the Budget Committee, we're going to hire a full-time Waymaster so that we don't have to rehire every 6 months. So Public Works budget by fund. And this, we have total requirements in this budget of $154,508,000. Out of the general fund, the requirement is for county facilities, property max, system development charges, manufactured structures permits, tax foreclosed property. We also have the road fund at 36%, and we have the special revenue totals, by the way, is $1.5 million, and the general fund requirements is $4.1 million. Solid waste disposal fund is 24% of the entire fund, and land management fund is 7%. I won't go through the entire pie chart for you, but that's essentially how we are budgeted. So our Public Works revenue for 17-18, we receive revenue from state grants, federal revenues, other state revenues, property and rentals, licenses and permits, fees and charges, administrative charges. And so just going through the fees and charges, most of those come from ECS. We get $661,000 from ECS, and also from the Corners Perpetuation Fund. In Fleet, we get $7.5 million in fees and charges. The Land Management Division gets $3.4 million. Land Event Center gets a little over $300,000. And then finally, Waste Management, it gets the bulk of that at $17.6 million. The other state revenues that we receive include the highway funds, the gas taxes at $19.7 million, and then the OTIA, or Oregon Transportation Investment Act funds of $1.1 million. Also get recreation vehicle fees from vehicle registrations for the RV funds at about $500,000. This is a slide that's very close to the last slide, but there's a couple of things that I wanted to point out here. First of all, I'd like for you to see that our fees, charges, and fines, that revenue is going up. But one of the things I also want to point out is that our state revenues are going down. We are hoping there's going to be a transportation package passed this year, but one of the things that we know is if we don't get additional revenues, we will not be able to maintain our road and bridge network in the shape that it's in right now. And really, that's all I wanted to show with that. So for the overall budget and our expenses, our operational expenses are down 4.18%. A lot of that is from belt tightening, and a lot of that is from the operational efficiencies that we have accomplished in the Waste Management Division. For our capital improvements, you'll see that we have $8.3 million. $1.3 million goes to Waste Management, and that will include some heavy equipment that we're purchasing there, pit wall improvement out at Glenwood, an Oak Ridge trailer improvement. We're putting some scales out at Florence. That you'll see later that that's down from the capital fund that we had with Waste Management last year. Last year they did quite a bit of improvements out at Glenwood, so that's the reason that's going to be down. Fleet, we have $1.9 million in capital funds, and that's for vehicles and heavy equipment. And finally, roads and bridge capital fund, that is for pavement overlays, bridges, bridge improvements, slurry seals, slide repairs, etc. The materials and services constitute about $31 million of that fund. Reserves and contingencies. Christine spoke last night that the GFOA recommends that we have 16.7% of operational contingencies at all times, and that the county goal is 20% operational contingencies. We are certainly not there in many of our funds for operational contingencies, but what you will see is that we have larger reserves in some of our funds. I'll go through those in details as we discuss each of the funds, but certainly you'll see that in solid waste disposal we have 26%, Now, that's not just operational contingencies, that's also for opening a new cell in the future. That's for the regulatory requirements for closing the landfill, and then the regulatory requirements for landfill closure maintenance as we move forward.
Tim, is that 26% of the 76 million, or is it 26% of solid waste annual operating budget?
Of the 76 million.
Okay.
So in land management, we have a contingency or a reserve in there right now of 4.9 million. That's out of about a $6 million budget. Our goal there is to have 1 year's operating funding in the reserves. The reason for that is that division is the most susceptible to economic variations, and we don't want to be in a situation where we have to lay people off and then hire people back on. So Lydia has done a tremendous job ensuring that we have some reserves there so that we can handle those economic variations. The motor pool and equipment fund, we've got a reserve of 24 million in there. That will be one of the funds that we're looking at through the auditing process this year. Let's see, what else do I really want to hit? The road fund is at $23 million. And the road fund, we will be going through a road fund reserve analysis this year to ensure that that's the right amount of money to have in that road fund. We've been very careful with the road fund reserve over the past several years. We knew that the SRS funding was going away. It has gone away now. We did not want to be in a situation where we had no capabilities of handling emergencies. So I'll talk about what all constitutes that 24 million as I get to the road fund. But that is one that, like I said, we'll be developing a road fund reserve analysis. And then special revenue reserves and contingencies for animal services, parks, system development charges, manufactured structures, and tax foreclosed properties. That totals about $1.1 million. So we'll start with parks and animal services. So the total requirements for Parks and Animal Services is $4.9 million. And in this, of course, it's parks and camping operations, the parks system development charges, animal services grant. This includes the transfer from the general fund. When you look at this, so 4 different funds come into this division. And the licensing and permitting is for animal services. We get in taxes and assessments, that's $964,000. That includes the transient room tax and the car rental tax. And other state revenues of $569,000. That includes the recreational vehicle fee and the gasoline tax refund. So for our requirements in this fund, you'll see that our expenses are up 1.7%. The personnel expenses are 1.7 million of this budget. Our total requirements are 4.9 million, as I mentioned before. Material services are 2.2 million. Capital expenses are 71,100, and that would include park repairs, the camp lane, cabin, and machinery and equipment for a fee machine so that we can better capture the cost of people that visit our facilities. This does not include the dog box that was spoken about last night. That is being paid for out of the fund. So, and then the reserves and contingencies will include parks operations. We have $557,000. Animal services operations, we have $80,000. Covered bridges, $28,500. Park STCs, we have $99,000. And finally, animal services grants. And this is a gift that was given to animal services this past year. We have $98,000 left in that for total contingencies, reserves and contingencies of $864,000. Some of the challenges that we face in Parks and Animal Services, certainly the Parks Master Plan, I mentioned that a little bit. And then the Animal Services addition of a .49 FTE for a part-time animal welfare officer. We also, some of the challenges we face are unfunded deferred maintenance in our parks. As I mentioned, we maintain 71 parks, and there is $17 million worth of unfunded maintenance. And then at Fern Ridge, Sewage Lagoon is rising to a critical stage, and we're going to have to look at doing upgrades to that sewage treatment system. We don't know. We think we'll probably come in with some type of a modular system on that. It might be a membrane bioreactor or a sequencing batch reactor, but a modular sewage treatment plant that would go in there and could be cost effective for us. We don't have an estimate on the cost that might be yet. Then in Land Management Division, for the overall budget, the total revenue is $6,221,000. And that includes fees and charges of $3.4 million. Now, fees and charges will include land use applications and all the associated fees and charges that go along with that, including the long-range planning surcharge, which we have estimated to be about $350,000 of revenue. We also have in the licensing and permits, that would be our building permits, whether it's structural, mechanical, plumbing, electrical, etc. We expect to receive about $1.8 million in that. We have federal Title III reimbursements, or for the fire-wise, that we are still using up the funds that have come into the county, but that program is part of the SRS program, and the funds will no longer be allocated. And so when we use up all of those funds will be gone. And then finally, we get about $105,000 in video lottery grants. The total requirements in land management include reserves, an operational contingency, and an economic stability reserve, and that's what you see in the $4.9 million for reserves and contingencies. And then personnel expenses and materials and services. As I mentioned before, the expenses here are up 7.3%. That is reflective of the additional building permits, land use applications that we're receiving, and the fact that we're needing to add FTEs to maintain the level of customer service. So the challenges and changes ahead for land management. So we're adding an associate planner, a land management technician, and a compliance officer. We have key long-term employees that are retiring. As a matter of fact, our compliance officer is retiring. We just found that out. And so recruiting is going to be huge in this division. We have building inspectors that have been here for a long time that are retiring, and our recruiting process for them has been dismal. We have not been able to get people interested in working for us for the amount of money that we're able to pay them at this point. The recruiting for the type of professionals we need is very, very difficult. One of the challenges that we're going to have to face. The other one that we put in here is that we're having an increase in appeals through the land use applications. What I do want to say about that, however, is that Lydia has done a tremendous job reaching out to individuals and groups that feel the need to appeal land use decisions. She has opened up a line of communication that I think is unprecedented. She and Keir Miller both have done a tremendous job. It hasn't resulted in fewer appeals yet, but I do expect that in the future it will result in fewer appeals. One of the things that I love that Lydia says often is that reasonable people can disagree, and so currently what we're finding is that reasonable people do disagree, and we do have land use decisions appealed, but like I say, I do expect that those will lessen as we move into the future. Waste Management Division revenue. The total revenue in Waste Management Division is $18.5 million. Most of that is from garbage and related fees. So that is $17.7 million is in just garbage and related fees. We also get property and rentals in the amount of $533,000. Now that includes any recyclable material, scrap metal sales that we have, and then we have interest earnings and fines and forfeitures. Again, one of the things that you'll see with waste management is that the expenses are down 7.3% from last year, mostly due to operational efficiencies. And So last year, as we were trying to close the structural gap in the waste management fund, Dan went out and had several meetings in remote areas trying to figure out what we could do. One of the ideas was to close a lot of the remote collection facilities. In the end, that became unnecessary because the users came and said that they would be willing to pay more money. That is very rare in my career that someone would do that. Now, we did close one facility, but the other thing that he did, which was very beneficial to the system, is to have the commercial haulers go directly to Short Mountain Landfill. That will help us tremendously. So capital, we've talked a little bit about what the capital fund will entail. And then also the fiscal transactions, that is moving $1.2 million in one of the various reserve funds to ensure that we're healthy as we move forward. I've got a good graphic for you in a second. Other than that, we have $8 million in personnel expenses and $7.5 million in materials and services. This is the graph that I really liked, actually, when Dan put this together. So this shows the reserves and contingencies, where we are now and where we expect to be in the next few years, and what is needed by the year 2025. And what I would say on the year 2025 is the future is close. It is only about 7 years away. So as we look at these numbers, Dan has, as I mentioned before, he's a visionary, and we will meet the needs as we move into the future, but we'll have to have money for future cell development, for regulatory requirements for closure of the landfill at some point in the future, and then also have to have post-closure maintenance as well. Now we'll go to the Lane Event Center. Again, this is run by Corey Buller. The total requirements in Lane Event Center are $6.7 million. And you'll see that the LEC fund, which includes the event center operations and the Lane County Fair, is 53% of the budget, and then the Lane Event Center capital is 47% of the budget. So this year we moved the facilities improvement projects from the county's capital facilities fund to Lane Event Center capital facilities fund, and that's in the amount of about $1.5 million. That is a double-edged sword for the Lane Event Center. What it means is, on the one hand, that they have more control over those funds, those capital improvement funds, but it also means that they're on the hook for all the expenses for the capital improvements that they will be dealing with in the future. So that is a significant capital improvement fund. We're certain from the facilities assessment that we're going to be doing that it will not be enough to handle us into the future. We will be good stewards of those money and continue to put into that capital facilities fund as we move forward. Operation total requirements, that includes admin, that includes $1.1 million for the fair, $1.6 million for the convention hall, catering concessions. Ice arena is $128,000. The sports center is $29,000, and sales and marketing for $106,000, for a total operations requirement of $3.5 million. So the overall budget, we have taxes and assessment. Now that's the transient room tax, and that's in the amount of $1.6 million. The other state revenues of $52,000. That is something that every county that puts on a fair gets some money from the state every year, and we get $52,000 for that. Property and rentals, that would include the fair and the event center rentals, and we say they're the event center rentals, but that also includes the fair rentals, and that's to the neighborhood of $2.2 million. And then their overall budget is $1.5 million in personnel expenses, $2.1 million in material and services. Then we have fiscal transactions of $395,000, and that includes $110,000 for a roof bond payment and $285,000 for transfer to capital projects. And then we have the reserves and contingencies that I've already discussed. So our changes and challenges, we're going to do the facilities condition assessment. One of the things that Corey has wanted to do, which I think is brilliant actually, is then do a market demand analysis to see what types of demand we're going to have on the facilities out at Lane Event Center. With both of those in hand, we will develop a business plan and we'll develop a capital improvement plan that will go hand in hand with that. Some of the challenges include unfunded deferred maintenance. We'll see how bad that is when we get to facilities assessment. And then I put in here fair entertainment. And this year we had a harder time tying down the fair entertainment. Part of that is because a lot of the entertainers are getting paid more on the East Coast than they are on the West Coast. Corey and Rachel know way more about this than I do, and it may just be a hiccup in next year that we won't have such a challenge. But I just put this down here just to say that it could be a challenge in the future, that we might have to increase that budget to be able to get the same type of quality entertainment at the fair that they were able to achieve this year. So next is engineering and construction services division budget by fund. So these are the requirements for that division. Total requirements are $14,600,000. 79% of that comes from the road fund, 8% comes from the corner preservation fund, 9% from special revenue fund, and 4% from the general fund. So the general fund funds property management, and you can read the others. And then for our revenues, we get state grant revenues, which would include, we get a fund exchange from ODOT, and that's a fund exchange at 94 cents on the dollar. What that means is that those funds change from federal funds to local funds, and therefore they don't come with the same federal requirements, the permitting requirements, some of the other requirements that the federal funds come with. So we get an exchange for $932,000. We also have ODOT project grants in that fund. This year it's $657,000 for 2 different road projects. And then we have capital project design, planning, surveying, inspections, and material lab funds from ODOT at $333,000. Other state revenues of $223,257 include the manufactured structures and tax foreclosed properties. Property rentals will include tax foreclosed properties and property management, which includes the parking revenue. So if in the future we do away with the butterfly lot, we could see these revenues go down. So just for you to be aware of that. And then fees and charges of $1.1 million. That includes the corner perpetuation, materials lab. We do work for other entities and get paid back for that, and other miscellaneous charges. So our requirements in engineering and construction services include $5 million for personnel expenses, $3 million for materials and services, $5 million for capital expenses, and I spoke before that that's overlays, slurry seals, etc. And then $1.5 million in reserves and contingencies. Some of the changes and challenges ahead in this division include the Transportation Safety Action Plan. This is a new plan that is being proposed. It will be adopted hopefully by the Board of County Commissioners soon. This has come about, first of all, we'll be the second county in the state that has adopted Transportation Safety Action Plan. This has come about because we had the highest number of fatalities in the county than any other county in the state for the years 2014 and 2015. In 2014 we had 45 fatalities. In 2015 we had 57 fatalities. That is an increase of 26%. We also, from the years 2009 to 2014, the leading cause of death from ages 1 to 24 were traffic fatalities. It's certainly something where we need to put our emphasis, and it's going to, in the end, it will be one of the most important projects that I will tackle for the rest of my career. Part of the Transportation Safety Action Plan, one of the things that we're doing is that we're partnering with Health and Human Services, the Sheriff's Department, and Public Works Department, and hopefully with emergency responders as well, to do a crash investigation team. We're no longer looking just at hotspots when we look at fatal crashes. The old way of looking at reducing fatal crashes is basically hotspots, and it still works in urban areas in many ways. But in a rural area, you can find 1 or 2 or 3 or 10 hotspots, and then from there, you have to start looking for the systemic causes of those severe and fatal crashes. And so this team will work together to find the systemic causes, bring back proposed solutions, and we will reduce the number of serious and fatal crashes in Lane County in the next several years. The commissioners have found this to be so important that they put it in their CHIP, or the County Health Improvement Program. We also have about $1 million budgeted for bridge deck overlay and structural repairs. We've talked a little bit about the new engineering intern program, which will add 1 FTE. Peggy is working diligently to get her team, her organization certified as a certified agency for ODOT. What that will mean is that we can then manage the federal projects and would have much more control over how those projects are handled. It would also mean that we could manage federal projects for other local entities that didn't have that certified agency status. So she's working very diligently to make that happen. We are recruiting to fill 6 positions. I should keep this so that I could just put a sticker there and keep changing that, because we're having a lot of positions that are coming open, especially with, as I mentioned before, the PERS discussions that have been happening up at Salem. We've had a lot of people that have put in resignations due to that. And so we'll be going through the recruitment. That in itself is fine, except the problem is we're not the only entity that has had long-term workers that have been scared off by the talks that have happened, and so we will be recruiting the same individuals that the other agencies will be recruiting. So we see that that's going to be a challenge for us to ensure that we have a full workforce by next year. The NPDES stormwater regulations, that is in the urban area. NPDES is National Pollution Discharge Elimination System. It's also sort of referred to sometimes as the MS4 permit. Those regulations are changing, and we are going to have to ensure that we comply with those regulations. We don't have a funding source to help us comply with those regulations at this time. We currently partner with the City of Springfield and the City of Eugene, but that's with the old regulations. We're going to have a challenge of ensuring that we'll be able to maintain our permit requirements with the new regulations as they come out. This will dovetail into the fact that we have drainage issues in the urbanized areas. The cities are able to collect drainage fees, and we do not have any mechanism for collecting drainage fees. So we have stormwater drainage facilities. We don't collect any additional fees for that. So you could have houses next to each other. One's in the city, one's in the county. One is paying into a fee that could help them, one is not, and they both want the same services, of course.
And it would be in charge by you, would all pay anyway.
That's right. And then another vulnerability that we have right now are seismically susceptible bridges. This is another effort that Peggy is spearheading. Everyone's heard about Cascadia Rising, I think. It's a 9.0 earthquake that we're expecting in the next 40 to 50 years. And so ODOT has gone through and they are looking at all of the local bridges to determine whether or not they're seismically susceptible. The simple bridges, in other words, the single span bridges, are not being evaluated at this point, because the idea behind that is that if you lose one of those, you can throw a Bailey Bridge or some other modular structure over the top of it, and it's not a big deal. But it's the multi-span bridges are the ones that they're looking at right now. We don't know the number of Lane County bridges that are susceptible. We will know that soon. The mandate will be in the millions of dollars that we'll be needing to upgrade our bridges. Transportation Safety Action Plan, I did throw this in here. Together we can save lives and reduce suffering. Becky Taylor and David Reeser put together this plan. They are tremendous transportation planners, by the way, very, very dedicated public servants. Becky Taylor was named the LCOG Public Servant of the Year this past year. But one of the things that we know is that we have a serious problem. We have to look at it in new and different ways. to make sure that we can make a difference going into the future. I won't go through all of the verbiage on the slides. I will say that even though most of the lane miles traveled, vehicle lane miles traveled, are on urban roadways, 54% of roadway fatalities are in rural areas, 53% of fatal crashes are roadway departures, and 39% of fatal crashes involve speed. So these are just a couple of slides showing the need for road or bridge maintenance. And we also have some scour critical bridges that we're going to have to tackle in the future as well. So, Road and Bridge Maintenance Division. Our revenue in this division is $1.1 million, and with the federal revenues of $905,000, most of that is from the FEMA funding from this last year's ICE event. That we've got about $630,000 from that. The remainder of that is from the Federal Lands Access Program, or FLAP program, and that's for the High Prairie Chip Seal project. We also have fees and charges, which include reimbursement for striping and road maintenance services, and property rentals, license permits, etc. The overall division budget is right at $16 million. The expenses are down 1% in road maintenance. And again, this is just through tightening our belt, understanding that last year we did 56 lane miles of chip sealing. That is not a sustainable number of chip seal miles, not a sustainable maintenance program. We're trying to keep it the same or higher this year if at all possible, although our materials and services are down by 3.7%. So our changes and challenges ahead include traffic engineering and electrical has transferred from road maintenance to engineering and construction services. We talked about one additional FTE for the Waymaster in the road safety program. This was handled, I think I mentioned, by an unclassified temporary position in the past, so we're asking for that to be one full-time employee in the future. We have unfunded deferred maintenance, reduced chip seal miles. We have stormwater issues. I mentioned that before, not only the MPDES, but also the stormwater systems that we have in the urban area that we don't have any funding to maintain. And then ice, rain, and wind. As you can see, we have a picture of the ice storm, the wind storm, and the rainstorm. Then the administration division. So this division houses the gas taxes. So the road fund is 98% of this fund. Includes the general expense revenue for road services and public works administration. And then we get an animal services transfer from the road, the general fund, sorry. The overall budget includes other state revenues. That's going to include the gas taxes of $19.7 million and then the OTIA of $1.169. Property and rentals, that's from the Customer Service Center. The federal revenues that you see on this slide are from timber receipts. And then we also have interest earnings, administrative charges for internal services. So total revenue in this budget of $25,227,000. The expenses in this budget are down 8%, and this is purely through tightening of our belt, and then also the way that we are looking at open positions, how that we're looking at the funding of the open positions. You'll see certainly that the personnel expenses are $2 million, materials and services are $794,000, and then fiscal transactions of $1.2 million. That $1.2 million includes $845,000 transfer to the Sheriff's Department, and then general fund transfer to animal services of $400,000. Then reserves and contingencies. The operational reserves right now, that is the 17%. That's where we're sitting. We also have set aside a road and bridge emergency reserve fund of $5.9 million. That's $2.5 million for roads, $2.5 million for bridge, and $900,000 for cash flow. I'm sure you can tell that we used a stringent algorithm to come up with those numbers. And then finally, for future projects, we have $11,800,000, and we will analyze that number as we go through the road fund reserve analysis as we move forward. Some of the changes that we have, changes and challenges. One of our challenges is just making sure that we can continue with the same services that we had in 16 and 17. We've got a new director. We will have a new assistant director starting June 5th. We've got a new county engineer who will have been here a year this July. Recruitment for vacant positions is going to be high due to turnover. We've got our deferred maintenance on the road fund and also the structural balancing that if we don't get additional funding through the transportation package, we're going to be in a world of hurt trying to make sure that we maintain our system the way that we, in the same condition that it's in right now. So the strategic plan, I won't go through this. You've seen this, I'm certain, a lot. The partnerships, we do have key partnerships in Public Works, which include Road and Bridge and ECS partners with state, local, and federal agencies to provide engineering, design, materials testing, road maintenance, and right-of-way services. Fleet Services partners with agencies in Greater Oregon Fleet Cooperative Procurement Group. The Lane Events Ice Center operates through partnership agreement. The Ice Center would have closed down. I'm sure you guys remember it way better than I do. Would have closed down had we not been able to get a great partnership there. Engineering and Construction Services works with ODOT and the City of Eugene to design and construct railroad crossing improvements. Parks and Animal Services partners with a lot of people, but also with agencies, nonprofits, stewardship organization, friends of groups, neighbors, the Arboretum to care for the Lane County Park System. Waste Management works with garbage haulers and industry stakeholders to coordinate on regional solid waste and recycling issues. And then, of course, the Traffic Safety Action Plan. Our partners will include several county departments, local agencies to work toward zero death and on zero traffic and roadway deaths. And if there aren't any questions from Alicia's presentation, I think this is where everyone applauds.
Dale and then Dick.
Hey, Tim. Can you talk about permitting times, the wait times on permitting, both commercial and residential?
And are you speaking in
building permits?
Building permits. We have someone here that can speak to that.
I am Lydia McKinney. So your question is with regards to how long it takes to process applications. I can't give you the exact days. What I can tell you is that generally speaking for our residential and commercial building permits, it's through a 6-week review. As many of you know who are in business, we do our first review and then we send that back to the applicant, the architect, the engineer for additional information. So sometimes that timeline is not within our control, but that's what we generally take. With regards to planning permits, it depends on what kind. We have some that we can do over the counter. We've been trying to do more and more of that so people can actually come in and do something quickly and we send them on their way. And we're looking at doing more of those things. Some things take a year, and that's a fast process, as some commissioners will attest to for doing something like a plan amendment for instance, Hazel Duck Quarry. It's something that we're very focused on, so we're constantly, I think, looking to improve our timelines. I think our timelines are significantly improved to what they have been in the past, especially when you look at the number of staff that we have doing the reviews. So we're really trying to increase our efficiencies, and we're very customer service focused. So again, a lot of the work that I'm working on with Tim and my team is to really think about looking at doing customer service improvements. How can we get people in and out more quickly? Because as much as we love doing building permits and planning permits, other people might not necessarily. And then, of course, to get those building permits reviewed as quickly as possible.
So does that include the couple weeks for when you schedule the plan review?
Well, so there is something called a building permit review meeting, and so that's that in the past has been 6-8 weeks out. We actually, if you want one, I can probably get one next week.
One of the things I so appreciate about Lydia and her team is that they are always looking at operational efficiencies and how we can serve our customers better. One of the things that we know is that customers aren't an inconvenience when they come into our customer service center. They're the reason for our being. And so we have to give them the utmost customer service. There are times, without a doubt, especially when permits are going up, but our full-time employees are not catching up with that at that time, that permit times can start lagging behind. One of the reasons that Lydia wants to add a new land permit technician is to increase the efficiencies and make sure that more people can do more jobs as they walk into the customer service center. We're not perfect. We're not where we want to be. One of the things that I love about this division management team is that we will never feel like we've got all the answers and that we've achieved the level of customer service that we want to achieve. We hold each other to high standards, and we shoot high. So we will get better at permit intake and permit processing. We have gone through some processes in the past to improve that. It is better certainly than it has been in the past, but we will get better even going into the future.
Commissioner Liken?
So this question is regarding waste management. So Dan and maybe even Tanya on this one. So have you taken a look as far as with Glenwood and the transfer facility, so direct route to Short Mountain, an analysis of truck traffic and what that means on the little interchange there? And if you could remind me, are there ramps going both ways?
There are not. So people have to get off at the Highway 99 Goshen exit. So it's about additional 70 trucks per day going through there. Which I don't think is huge, but definitely there's more traffic going through there and more heavy trucks, so it'll be a bigger impact on the roadway there.
And if...
But off the I-5, there's only the northbound. It would be wonderful if we had a
northbound ramp only.
Yeah.
And the other question is, as you know, and we've talked about this, so Douglas County is almost to the end of their capacity. And if Lane County were to put together an agreement, any idea of additional truck traffic that would be?
It would be, oh gosh, they are probably a third of our intake, so
another 20 to 30 trucks a day.
But they're probably coming in larger, transfer routes. So actually, maybe a third of that, and so not a whole lot. But something I would love to see the board take up with the state is to try to get a southbound off-ramp there for the development of Goshen. That's a huge multi-million-dollar project. But
you know what? I was going to ask you that question. I didn't even have to ask that question. That's fantastic. You already mentioned Goshen, so I didn't have to ask that. So, reason why I brought this up, because I just had a conversation with Senator Byer on this very issue. And he's going to be asking for head nods from the Board of Commissioners if we want to have Mr. Reeser begin the look at planning that so that we can get it into some sort of ODOT program before we start taking it United Front.
My head's nodding now.
Yeah, I know. We'll have to have a formal meeting. So that's the reason why I asked this question. So you believe that it would be beneficial for Lane County if we could put money into that to improve the interchange with ramps going both north and south.
I definitely think so. Yeah, if you miss that exit, you're driving clear down to Crestwell and turning around and down a few times. But for business there, for our long-term needs for landfill, I'd love to see some action around that.
And our capacity at the landfill is approximately?
Over 100 years. We're working on a new site development plan that'll come up with a new estimate, but our last estimate around, which is getting a little old, is about 100 years.
And for the record, I had lunch with Mayor Lumber today. She's thrilled by the idea that the transfer facility in Glenwood could potentially be used for other things. As we know, the city of Springfield has plenty of jurisdiction over Glenwood, and they view that as a great opportunity for future private sector investment. And so I think it looks like a win-win. And last I checked, Senator Beyer represents. Okay, great, thanks.
That is our long-term plan, and we'll be coming to the board hopefully this fall with our recommendations for the solid waste master plan that will look out in the future.
I believe Congressman DeFazio lives in Springfield. Great, thanks. All right.
Philip, you're up.
So going back to the Lane County traffic accidents, I just kind of wanted to reference, you said we are the highest county in Oregon. So there's been an increase between 2014 and 2015. Do you have the numbers of the other counties? Like how?
I don't have the other counties off the top of my
I can
head.
answer part of that. Lane County in 15 was 57, Clackamas County was second at 34. Wow. And beyond then it drops down considerably below that. So Lane County is nearly double what Clackamas County is compared to second.
Thank you so much.
And if I could ask a clarifier on that, just so that I make sure I have it straight in my head, is that for county road miles or for all accidents inside the county?
That's for all fatal accidents inside the county.
Okay, thank you.
Including West Main, East Main, and Springfield.
Yeah.
Okay.
Understanding that 54% of those happen on the rural roads.
On the rural roads.
Okay. So not on I-5 or 126 or so forth. Is that, it does include.
No, I don't think that includes state highway, does it? Does that include state highway too?
Yes, it does.
So it does. So Highway
Okay.
58, for instance. Okay.
Thank you.
But over half are on rural roads.
It's a serious health issue, and part of the reason why it made it onto the chip. I'm thrilled to be working with H&HS on this issue and with the Sheriff's Department. And it's something that will change the life of our residents when we succeed moving into the future.
Okay, Commissioner Williams.
Thank you, Mr. Chair. Great presentation, very thorough and comprehensive. Also, I'd like to thank everybody that in their purview for the excellent work that you all do. I've observed it sort of passively, but in the last 3 or 4 weeks, I've not been quite so passive on that. My time in municipal government over the years, there were 3, maybe 4 primary concerns that the citizens brought to me time and time and time again. 2 of those had to do with SDC fees, and I fully get how complicated SDCs are. We are looking at, hopefully, all across the board, I'm hearing that there's a housing shortage, and there's no denying the housing shortage in Lane County. So development is coming, and I see, I'm hoping that there will actually be a building boom. What I look at, and probably the overarching number one concern that I heard SDCs joined at the hip with the permitting process. And with permitting, it was always that, it was just a long and arduous proposition for the citizen to get timeliness in regards to that. And I appreciate what your reviews and all of that are comprehensive. Some are simple, some are very, very gnarly. So I get that, but I do look at the building necessity that we hear over and over and over because of the lack of housing, affordable housing and otherwise, and that permitting is going to be one of those things that there will be a flurry of, as in my estimate. And so I just am mentioning that, speaking to the obvious, that there will be a lot of people coming in wanting to do projects and wanting to do them yesterday. And so I just mentioned that my experience in municipal government is not much different than probably what we're doing here in regards to both those issues, SDCs and the permitting process.
Thank you. And for that, I would like to praise Lydia and Tanya and their foresight in ensuring that we have a strong, healthy reserve in that land management division, because with that reserve, we'll be able to be reactive. and quickly reactive to any additions and permittings, and to be able to hire people quickly. If we did not have a reserve there, we wouldn't be able to do that. We'd have to wait on the revenue to come in before we could react to them.
Well, thank you for that, and again, thank you for an excellent presentation.
Yeah, so on your slideshow, it showed like 2 million or so coming in on fees, from permitting fees, about 2 million, I think 1.8 or something. What's the kind of more or less return on investment of a staff position for that, in terms of, does a staff position pay for itself in permitting fees over the course of the year? And does it pay for itself in excess? You know what I mean?
So, yes and yes. For building and planning, the fees that we take in are required to be used for those services. So there's really a direct, and Tanya will tell me if I get too out of line. So there really is a direct correlation between those things. As Tim mentioned, we have a long-range planning surcharge of 13%. That funds some of the long-range planning. And long-range planning is like Envision Eugene is the most common thing we've been talking about, but there's our code writing lots of things. So, like I say, because those services are directly tied to the fees, they essentially have to be sort of cost-effective, as it were. There are other revenue sources that come in that aren't just specific to building and planning, because a lot of the work we do, customer service, for instance, we don't get money for that. People coming in the doors, we welcome them. We have partnerships with the Waste Management Division, so there's some tipping fees that support that, as well as the code compliance that we do that does not pay for itself. And never would, in my experience. I started in Cottage Grove and looked at their code compliance program. Those don't tend to pay. But does that help?
Yeah, just one more question. So the main hurdle for reducing permitting time is the recruitment and retention.
It is actually, absolutely. And like Tim said, making that reserve in the budget allows us to not do what we did in 2008. I wasn't here, but the staff was reduced from 44 to 22. I hope that never happens again. The years to build the staffing back up, some of who were lucky enough to be able to hire back some of those people, that takes a long time, and it's complicated. I have to say, it's not rocket science, but it is complicated. The issue that Tim alluded to with regards to the retirees, we have our fabulous code compliance officer retiring. We have a plan, don't worry. We have a lot of building inspectors who are retiring, and we don't have a plan. That's the challenge. So right now, it's not permit review, it's not planning, it's inspections. We've got a plan, so right now we're using sort of people who will come back, and so this summer I think we'll be okay. But that's why I really appreciate working with Tim and you all to be able to kind of add some positions and help figure out how we can address this issue of inspections.
One more question from me.
No, Philip?
So the other question that I had here, so you mentioned Peggy was working to get a certified agency for ODOT, right? So question would be whether that would also increase our opportunity to apply for other grants that maybe we don't currently apply for, or some additional state revenue available to us because of that?
It would certainly allow us to keep more of the funds for any federal projects that we apply for. It could, I suppose, give us the opportunity to apply for more.
Yes, one of the things that we've seen is that when you submit an application for a project, they like to see the ability of the local agencies being able to do the work in-house. And because if they're not certified and the work has to be done by ODOT, or they don't have the staffing to do all the work that's out there. So there is that leverage there. And it also gives us the leverage of being an agency that other local jurisdictions can go to do the work.
So it can give us a buffer during slow times as well, so that our engineering staff, right-of-way staff, surveying staff can help other agencies.
Thank you. Commissioner Clark.
Thank you. I'll be very, very brief. Tim, you mentioned Bailey bridges. Before I graduated to the infantry, I was in the engineers. We built them, and that's not the preferred method for long-term bridges. I wrote a couple of quotes down which lead up to my question. We actually have a dream team in public works. I love what you said. And I call Corey Buller and Rachel Dillon let's say the dynamic duo, you said, and Shonda Miller changed my life. What that tells me is that you are really fully attuned to all levels of customer service. You've demonstrated that over and over and over again. So I have 4 questions on customer service that I'm going to write down and pass along to you.
Great. Dan?
No, I'm not going to go back. Sorry.
Sure. Last question.
Okay, and it'll be quick. I noticed one of your goals for next year is to reduce department fleets by 10%. What's the rationale and how are you going to do that?
The rationale behind it is just to minimize the fleet cost. Now, I think it's a very astute question when you get right down to it, because it doesn't change the number of miles that people have to drive necessarily if that piece of equipment is needed. So that's part of the reason I think that Steve has asked me to go through a more thorough auditing process with the fleet fund, to make sure that we are reducing anywhere we can. It may or may not wind up being 10%, probably won't be quite 10%, but also to find other efficiencies. And I'm not positive I answered your questions.
Well, it seems that people are going to still have to drive. They'll use their own vehicles probably, and you get reimbursed in mileage.
It's an astute question.
Mr. Chair, and it is a good question. This is part of our overall approach to look at internal expenses. So we've said before, we are going to look at reducing services to the community and laying people off. We need to look at all of our internal expenses. We talked about health insurance, we've talked about debt, we've talked about computers, we've talked about workers' comp and general liability, and our vehicles fall into that. Part of, I think, the thinking, at least on my part, is we've seen in many areas a significant decline in the number of employees providing services. We talk about public safety, assessment and taxation, road and bridge maintenance. So at the same time that we've seen a decline in the number of people providing direct services, let's make sure that we have the appropriate amount of vehicles as well. So it's really, we set a goal of 10%. I will say it was largely arbitrary. It was a goal to shoot for something. And we've worked with Fleet, and Fleet is working with departments, with their customers to say, what can you live with, what can you not live with. And we've identified a number. I think we've gotten about halfway there.
We're about a little over 6% right now. It's a 2-year process to get to that 10%. And then we've got some tools this year that we're bringing online, a telematics system that we installed in the vehicles. It'll give us much more detailed data on how the vehicles are used on down to an hourly basis if we want to look at it. So they may have vehicles that aren't getting the type of usage. They may be able to combine, get rid of one of them. So that's what we'll be doing. But we got the 6% just by the low hanging fruit, just asking for people to turn things in. Now we're going to do the hard work of really doing some analysis on the usage patterns.
Okay. It is a little after 4:10. Are there any more public works questions? Because we could devote some more time to it if we want to, since everybody's here, assuming there is really no budget committee business. Okay, so budget committee business is done. Any other public works questions? Dan? I cut you off, I apologize.
No, I'm not going to go back to it. It's fine.
Okay. Okay. Then we are adjourned, and we are at 1:30 tomorrow.
Thank you.